Hi, guys. Welcome and good afternoon to all our viewers who are watching us live on Facebook. I am here with another success story of NAI. I have RN Jefrey with me. Jeffrey has been a student with NAI. He gave his exam in June 2024, and Jeffrey has been successful. And Jeffrey is here to share his experience of taking OSCE with NAI. Hi, Jeff. Are you there?
Hi, Sir Georgie. Good afternoon to everyone. It's my pleasure to share this story with all of you.
Thank you, Jeff. Welcome. Very warm welcome. It is very good to see you again. It's always nice to see someone who has crossed that border and
Yes.
are our colleagues. So you welcome to nursing in Australia. So Jeff, could you tell us a little bit about yourself, your background and stuff like that, so the viewers get acquainted with you?
Yeah, sure. So once again, good afternoon, everyone. Um, I have been a registered nurse way back in the Philippines for 15 years. So it is a public hospital that I have been working with, and before I left the Philippines, I was the officer in charge as the chief nurse of the public hospital. But then my family migrated to Australia, and that's how I was also dragged along with the migration of the family. So that's how I entered Australia as on a student visa and worked as a personal care worker in an aged care institution.
Okay,
So yes,
I like the usage of the term you said, dragged along with the family migration. But
yes, sir.
I'd say it was a good drag.
Yes, it is. It definitely a good drag, and it's all very purposeful. So, yeah, it was my. I was happy that I was dragged along in here.
Okay, so from this, I can certainly understand that you're very happy as chief nursing officer back at home, and then you came over to Australia and you wanted to start off your career as a nurse. Then you were hit with the OBA pathway. So tell us
Yes.
about your a little bit about your NCLEX preparation as well.
Yeah. So actually, when I came here in Australia in 2022, and the original plan is that I take the whole OBA pathway. I should finish it in within 1 year time. So I was expecting to do it in 2023. But I had this fear, if you've already been so long in the nursing industry, you've been practicing for so long, I had a fear, and I believe this is a common fear among all nurses, of failing an exam. That's why
Mhm.
everybody loves to do uni, even though it's very
Yes,
costly,
yeah.
because the fear of failing, and then everybody knows, oh, he fails. So that's one of my struggles. So I kind of like delayed taking the NCLEX, but well, the inevitable came. So migration has become tighter in Australia, and though they have promised so many things with personal care staffs, for work visa sponsorship, but it's not happening very soon. So that's why I had to push through with my original plan, which is doing the OBA pathway. So I was originally enrolled in another with my agency, my visa agency. They have actually booked me in a with another review center for NCLEX. And yeah, because this is very theoretical in nature, so it just measures how the way you think, how about how the nursing theories that you have actually previously learned. So I should say it was quite a very expected um, journey
Uh,
with my NCLEX. Yeah,
so- and with all your experience and expertise, NCLEX would have been a cakewalk for you because it's mostly your clinical, your
it
theoretical
helps. It
knowledge and
helps.
your clinical knowledge. So it comes handy. So tell us, how did you hear about NAI?
So yeah, so I had this former staff of mine who also took NCLEX and who did OSCE, and she was from Brisbane, and she also was enrolled in NAI. I was asking her about what was her experience from the review center from NAI, and she was very convincing to me. She was telling me good stuff about how the instructors were, how the laboratory was done. It was such an organized thing that she said, if you just follow the procedures, if you just follow what they say, you'll certainly pass. So in my mind at that time, that was a good actually advertising, because I was looking for somebody who can help me to really succeed, because I don't want to fail, because I have been for 15 years of experience. I don't want to fail at this point of time. So it was quite a pressure. So yeah, I've heard it through a friend, and I've looked into the reviews in Facebook, and I've also emailed. Tentatively, I emailed December when I wasn't sure yet, and NAI was very responsive to that. I actually tried so many review centers, but only NAI was the one who was really responsive to me at that time.
Oh, that is very good to hear. I'm sure the admin staff would be very happy to hear that. Now, if you don't mind me asking, who was that friend of yours who was our previous student?
Jenny Seligio.
Oh, yeah, Jen. Yeah, yeah, from Brisbane. Yeah, cool. So, Jeff, tell us about, you came to Australia on a student visa, you are working as a PCA, and suddenly you sign up for this. So, how did you find the online experience, the online training? Because I know that you have abundance of experience behind you. You have just recently cleared NCLEX. So, when you started off with your online training, what did you feel?
Yeah, so the thing about the online training, it was very good because it was all recorded in Moodle. So,
Mhm.
and because working in an aged care institute, in an aged care facility, you will have to be working on different time frames. So it would be very comfortable for me to access these online modules whenever I'm comfortable or whenever I'm free. So aside from that as well, you know the online um, training or online lectures has provided me that bridging course of how it is to do or what is nursing in Australia, because it's really different. Even if you have like 15 years of experience as a nurse from your home country, it's really different here in Australia. So by looking into by engaging in the online lectures, then you'll see the an oversight of how it goes, of how and you have all the instructors were very good in explaining this forms, all of this stuff, and it's very helpful, Sir Georgie.
Okay, so you finished with your online training, and now here comes the best part, the face-to-face training. What were your expectations when you came for the face-to-face training, Jeff?
That's actually very funny because I was really scared of doing the face to face, because I am already like on my, I should say, on my middle age. So when everybody was asked about um brief introductions, I was quite, oh no, this is, I don't want to um I don't want to be like sound like, oh, he is already on his like so many years of experience, and then he failed. So I was really quite unsure about that. But that was the time also that I was assured the environment during the face to face was very welcoming, and that you will have an equal footing. Every one of you will have an equal footing. It was really emphasized at that point of time that yes, your experience will help you, but this is at the time that you have to listen to us, and that we are prepared to share to you something that will be relevant on your date of examination. So that was the most encouraging part of for me, that I said, oh, this is the perfect one for me. And um yeah, because I'm Filipino, I was really expecting that there would be a lot of Filipinos at that time, but I think there were only three of us. But I never felt at that point that I am different. I felt like it's a family. I felt like everybody will be helping. The instructors are helping. Your classmates are helping you. It's very welcoming.
These are family, Jeff. You use the right term. We always consider each and every student of ours as part of the family. And I'm sure many of your colleagues who were with you for your face to face are watching this live stream. I'm pretty sure about it. And they're feeling very proud and very happy that you're sharing your experience with them. Uh, how about the practice, Jeff? Tell us about the practice and the lab that you used.
Yeah, so it's really essential, Sir Georgie, that all of the students know that they have to attend the online, the face-to-face, and the lab practices. It was very emphasized by all the instructors that this is just a single time of your life, because 4,000 Australian dollars is really costly. You really have to spend time to practice, to get your focus, your mind on this thing, because it's not going to be that easy. The exam is not that easy. And everything will make sense if you go to the lab. Listening online, yes, it will form the foundations of what it is to be done, and then it will be exemplified during. You will see it. It will be demonstrated during the face-to-face. But because the exam is a clinical, observed clinical structured exam, so you have to perform it. The laboratory has actually given me that opportunity to be able to perform the skill. And the good thing about the laboratory is that you will meet a lot of people with different backgrounds. And again, because NAI is a family, and it's in the real world, you will really need help from people. You really need someone to practice with, to communicate, especially communication. You will be able to learn the skill, the attitude of being a nurse in the lab, not just the procedure itself. The laboratory has honed, for me, it has honed one of my attitude, to be patient, to be to be teachable, so that whenever somebody tells you, okay, I've done this thing, look at this, if this is a good practice. And then we have instructors who we can consult to, if these things are applicable, if the practice that we are doing is the right way. um, that gave me that confidence before the actual exam, that okay, I am really able to deliver this because I have practiced this one in the lab, and it's state of the art. um, I've actually been into CPR trainings here in Australia, and they do have dummies that are really not working, and it's far from being real. But NAI, wow, it's got an app. It's got it's really mimicking how you are doing CPRs with an actual patient. So yeah, you will really have the feel of doing it, and you get confidence.
One of the common things that students tell me when I ask them about the whole experience of OSCE is that OSCE is a very humbling experience.
It
So
is
what
indeed.
was
Yeah. Because when we were practicing, we were very prepared with scripts, with templates, and we were practicing this all over and all over again from the beginning of the lab practices. But the thing is, during the mock exams, and we were actually tested to be prepared to be interrupted, because that's the real actual scenario in the world. And I think that's what OSCE is doing. They are interrupting you from your routines and see
Mhm.
how you respond to these interruptions, whether you can deliver the necessary knowledge, skills, and attitude, especially with the attitude, if you're really willing to. In all of my stations, there were really tricks that they have employed. And
Mhm.
these tricks did not surprise me, because
We
um,
already.
yeah, and AI has trained me to detect these minor things, um that's it. It's not yeah, but you know this is the thing. I have 15 years of experience, and I thought I am good, but NAI really formed that habit of, hey, you need to step back and listen and learn, because there are new things that will come to you, and if you listen well, and if you take it by heart, you will be able to do it.
Yes, in your OSCE journey, I'm sure it was just not practice that happened in the lab. You would have had a little bit of fun and crack and everything. Could you tell us something that you will never forget in your during?
Definitely, sir. Remember, I did uh during one of the practice that we had, and then I did the ha 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 um thing. So it was like in the non-pharmacologic pain management,
Yeah.
where I was practicing to make the patient laugh. So I was like doing, okay, can you repeat laugh after me? Ha 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 ha. And then that was the thing about the mock exam. But I was prepared to do that in during the OSCEs, but I was interrupted. So as I said, I have to be prepared. So the case was a lady who had
Let's just not
flanking.
get into that into the stations.
Yeah,
Let's just keep it to yeah.
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 And then you
So
know how, yeah. And then you know what, sir? I was just like, because she said she cannot talk. I was and I cannot make the ha 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 thing for her. So I just sang for her.
well, good on you.
And,
Good on you.
and I was saying, hey, you know what? I'm supposed to do Voice Australia today, but I got rostered, so I'm here taking care of you. You'd like me to sing a song for you? And that was really effective.
Very well done, Jeff. Very well done. I mean, you have the right attitude to be working as a registered nurse in Australia. These kind of nurses are the ones who are in demand at the moment. A patient is in need of care. They are not in the best of their, physically and mentally when you talk about a patient who is admitted in a hospital. And if they get a very funny and very pleasant and really bubbly kind of nurse like you, it makes their stay kind of easier and the day gets on really, really faster as well. And that is applicable to the staff who is going to be working with you as well, Jeff. And I'm really glad that you paid attention, you listened, you learned, and you tried to implement that in your examination. Now, Jeff, a common question that I get from students, sir, I'm feeling very anxious. I really don't know. The anxiety is hitting me. And there is an exam that's going to happen next week. So how did you manage your anxiety? How did you calm your nerves down?
Um, I don't know. I think it came from being assured that what I am doing is actually right.
Mhm.
I was confident that I am doing the right thing because NAI during the practice, I have seen how they have demonstrated it, and I think I have done how it is. You have just to trust the process. Now, when you are in the actual exam, it's you will hear microphones, you will hear that you are really in a recording. It somehow makes you tense, but the thing for me with that is that I just like think that this is my actual patient. This is me when I am in the hospital, and I've been doing this for some time years in my life. So treat them as a person, treat them as a person needing your care. So just be caring, um be concerned of what their condition is. Sometimes, yes, you already know these things, you already know the template, you have all those patterns, but be willing to be interrupted and respond to their needs. Seize the moment and meet their needs. So yeah.
That's a very, very good way of putting it across. Again, seize the moment and yeah, get to their concerns. So, one of the things that I tell my students during face to face, I'm sure I would have told in your batch as well. The more comfortable you feel in your own skin, you try to be yourself during OSCE and try to deal with that patient as a real patient. That kind of calms your anxiety down because your training is going to kick in sooner or later because
Yes.
then that makes you more confident. And what about time management, Jeff? I mean, were you able to how did you manage to be able to manage your time?
I've actually finished all my stations. Um, just like what you have told us during the lectures, it becomes a muscle memory. So when
Mhm.
you are practicing, keep on practicing day and night, you practice, you keep your mind focused on it. It becomes really a muscle memory. You will not, sometimes during the practice, I tend to forget the IV pole. Every
Mhm.
time I forget the IV pole. But pretty mom always remind us, okay, make it a habit, make it a practice to grab the pole before you come back uh to
Right.
organizing your stuff. Yeah, so it becomes a muscle memory. So when you're in Yoski, you just don't know realize that, oh, I'm doing this, I'm doing that. It just
It
comes
just comes
in
natural. Yeah.
natural.
So the lab access 24 hours and anytime you want to go and practice, did that help?
Yes, definitely, sir. Um, And the good thing about that is we get to have proper rest as well. So being there 24 hours and 24/7, and then tiring yourself so much wouldn't do you good. During our time, we had a morning batch and afternoon batch. And we really agreed into that. We also formed bonds, eternal bonds, I should say, because until now, we are constantly communicating, and I've actually asked some of those students to if they are interested with a working visa, because one of my employers were also interested of that. I said, ma'am, they are trained from NAI. I am absolutely confident that they are good in skills. And yes, the laboratory access, it's very good. You'll have the right facility, and then it's comfortable, it's well air conditioned. So now when it's summertime, it's the heat is kicking up. Yeah, it would be comfortable in the lab to practice.
Yeah. Do you have any words of advice for those students who are going to take exam next week? They're going to have their the October schedule from Monday. Do you have any words of advice for them?
Yeah, I think first and foremost, we really have to be thankful, to be grateful of everything that has been shared to you. I know this may sound a cliche, but if you really listen to your mentor, to our trainers, and just trust the process and have a teachable heart, you will gain confidence that one day when you pass that, when you succeed with the exam, you will realize that everything will make sense. Everything like um just everything that you have been taught, that was for you to succeed. And also remember that whatever your mind conceives and that your heart believes, then you will receive it. So just focus your heart and your mind into what you are doing. Whatever situation you may be, um, when you're doing OSCE, focus on OSCE first. And then after that, then you will receive a good reward for yourself.
You manifest what you want and
Yes.
conceive in your heart what you need, and you will gain that. Is that what you're trying to tell? That's another very good word of wisdom, Jeff. You're full of surprises today, and I'm really loving this conversation that's happening between both of us. And I'm sure a lot of students are getting motivated by listening to you right now as well. So, Jeff, do you think passing this OSCE? I remember you sending me your registration and stuff like that, and you told me that you managed to make it. Do you think this entire journey with NAI, doing your OSCE and passing that, has changed your life?
Definitely, sir. Um, when I am now practicing as a registered nurse, it's not about doing, completing a task. Whenever I'm presented a task, I do not just do it for the sake of completing the task, but completing it in a manner that you have displayed nursing care to your clients. So this is what NAI has instilled in me, that you have to be really prepared to be interrupted from your routine and do and manage to address the concern. Sometimes, I get patients nowadays, they complain about this and that, and then for yourself, there are like theoretical nursing interventions that can be done for the patient, but sometimes that's not just how it is. It's about also giving them the time and attention that they need just to display your care.
Absolutely. I'm glad that NAI taught you the patient-centric care approach as well. And I'm 100% sure your employer is beaming with pride that you are a part of their team. And thank you so much for endorsing other students to your employer and vouching for them for the fact that they were trained by NAI, so their skills will be really wonderful. So how is the family, Jeff? How did they take your win and your success?
Definitely, we're full of joy. So my both of my siblings are here at the moment,
Mhm.
and actually, my brother's wife just came from the Philippines, and yeah, we're all celebrating tonight of the success of our journey here in Australia. And thank you, NAI, for making that happen with to me. Like, it is such it is part of my milestone in my life that NAI has been able to contribute to for me to transition into becoming a registered nurse here in Australia.
I can assure you, Jeff, while you're celebrating tonight, right now on this platform, we are celebrating your journey. We are celebrating your success, and we are happy that you're jubilant in your journey and you're doing amazing, wonderful things with that registration that you got. In 2 words, if I ask you to describe how you felt when you got your results, how would you describe it?
Oh no, it's the best. It's the
Okay.
best. Yeah, I was overjoyed during that time. I couldn't explain. I was texting everyone with NAI, the group chat, the OSCE group chat. I was texting in there everywhere because I am just so proud of that I have experienced the success, and I hope really more and more of our students will also experience the joy of finally becoming an RN here in Australia.
So you spoke about the course, you spoke about the curriculum, you spoke about the lab, you spoke about everything. What do you feel about the educators, Jeff? And and have they taught the skills not just for the OSCE or for your future career as well? Have you what
Yeah,
would you yeah.
this is what I love with NAI instructors because they get to the bottom of their experience to tell you how it is done here in Australia, the standards, how to comply with the standards, and just not just the standards, how you are going to be able to do it in such a manner that you it is an artistic way of doing nursing care. So it's above standards. Sir, I wouldn't have any idea of doing this without NAI's inputs. Like,
Oh my
when
God.
you were telling us about, okay, you can, when we were doing practices and then you were giving us advice of, hey, how about you do this, the suggestions that you have made. And we have actually applied that one. And not just you, surgeons, Ma'am Preeti, the rest of the trainers, they have given us inputs during that night. And then, yeah, we have all applied that one during the OSCE exam. And of course, I was really looking at my test results, and it was saying, oh, above average, above standards. So yeah, I'm so happy with how the it's really very family. And then um very responsive as well. I remember, Sir Georgie, when we had a difficult moment when there were new forms that we don't encounter, and then we asked you, Sir Georgie, what about this one, even late at night, and then you never fail to answer our questions
Yeah,
about these forms.
I guess. Jeff, I don't know if you know about this, but we NAI is coming to Philippines. So
Yes,
there
I
is
heard
an
that.
yeah. So why do you think so many Kabayans trust NAI?
Sorry, Sir Georgie, it was cut off a bit.
Why do you think so many Kabayans trust NAI? Because everyone we come across, they always say, "So why don't you open a center in Philippines?" So finally,
Oh
we
yes.
are opening in Philippines. Why do you think a lot of you being a Kabayan? So I'm asking
Yes,
you, what
definitely,
is the
sir.
trusting factor?
The thing about the Philippines is that coming to Australia to take just to review, experience the laboratory and the face to face, it would really entail a lot of money to come from the Philippines, just to come here to Australia to do all this stuff. So now that NAI has come to the Philippines, I am just excited to announce, even to my friends who are planning to take NCLEX and to do OSCE, I have already told them enroll with NAI. They have very good, credible background that will help you transition you to become your dream. And now that it's in the Philippines, so it's closer to home. It's just, it's in Manila, it's in the capital city. Everybody can travel there. It's more accessible. So yeah, I think that is actually a big help because yeah, it has eased some of the struggles of nurses coming here to Australia to take the OSCE.
You know, from us, from our point of view, Kabayans are a bunch of people that are easy to mix. They mix with everybody and they help each other. They have this caring mentality by birth. You guys are very caring. And I have spoken to employers who are actually looking only for Filipino nurses because they're very caring. And and it's an amazing it's an amazing thing that you guys can empathize with any situation. The empathy and the kind of it shows on your face when you are dealing with a patient that compassion comes within. It's not a made up one, it's a natural one. So that was another reason why we wanted to, open a center in Philippines where we could cater to the needs of a lot of Kabayans who could not possibly afford to be in Australia for a very long period of time to do their OSCE. Now, Jeff, I would like to congratulate you once again. And you are one of the best that I have come across. And you make continue to climb the ladders of success. And I'm pretty sure one day you'll be a director of nursing as you were back in Philippines. And God bless you abundantly. And once again, thank you so much for trusting us with the most important journey of your life. And you are family, and you will remain family. And thank you for all the support that you have given us here.
Thank you also, Sir Georgie. Thank you, Ma'am Preeti. Thank you to all NAI, to Anusha for always taking time to respond to our emails. Thank you everyone there in NAI. You are indeed a family, and I was you are all with me during my battle in OSCE, and yeah, thank you for helping me achieve my dreams.
Thank you, Jeff. Thank you. And you have a wonderful evening. And I'm sure you're going to celebrate with your family. May the good God continue to bless you and save you. Good night, Jeff. Thank you so
Thank
much.
you to Sir Georgie.